Hi everyone, my name is Kelly Reed. I am a physical therapist, certified lymphedema therapist, and board certified clinical specialist in oncologic physical therapy as of 2019. I currently practice in an outpatient setting in the Minneapolis, Minnesota area. And in this presentation, I'm going to be talking about the basics of breast cancer related lymphedema. So what is lymphedema? Lymphedema is an abnormal accumulation of protein-rich fluid in the interstitium, which causes chronic inflammation and reactive fibrosis of the affected tissues. So your lymphatic system is a one-way system that helps get rid of waste, toxins, and unwanted infectious materials, such as cancer. Your heart pumps blood through your body, through your arteries. Due to this stronger pressure inside the arteries, some of the fluid does leak out and moves into the interstitial space or within the cells of your tissue. The fluid is a clear protein-rich fluid called lymph fluid. Now, if this fluid just kept piling up there, it would be a problem. But this causes increased pressure in the interstitium. So then the increased pressure there causes the excess fluid in this region to be picked up by your lymph capillaries throughout your body. It moves up through your lymph vessels and eventually to your lymph nodes. Your lymph nodes help filter and detoxify the waste and infection before the fluid moves back towards your thoracic duct around your heart and into the circular system again. In breast cancer-related lymphedema, there is a dysfunction of the lymphatic system, typically after lymph nodes are removed for a sentinel lymph node biopsy or axillary lymph node dissection. Radiation in this area can also damage the lymphatic system, or someone may have an infection which can flare it up, or genetically one can have a lower functioning system prior to the added strain of cancer treatment. The lymph nodes remaining cannot then keep up with the demand of the moving lymph fluid out of the arm or out of the chest wall. This causes a backup of the fluid, resulting in lymphedema. The lymphatic system is made up into quadrants, so you will typically only see lymphedema in the quadrant or the side that had lymph nodes removed or radiation. This is also the side that an individual will remain at risk for lymphedema for life. Early detection and treatment are key in managing symptoms and avoiding significant progression of lymphedema. So when assessing or monitoring for lymphedema in your patients with breast cancer, you will want to watch for the following signs and symptoms. The onset is typically gradual. It does not usually come on rapidly like an infection would. You may see a loss of contour or bony landmarks. Pitting in the affected area or limb is possible. Your patient may report heaviness or aching in the arm or the breast, which is not related to the surgery or other treatment. Not always, but for many, the swelling may start distally in the hand or wrist, and you may see a positive stemmer sign. And as stated before, lymphedema of the breast and arm usually occurs unilaterally unless both sides are affected by surgery or radiation. And in later stages, you may see skin or tissue changes such as fibrosis or hyperkeratosis. So this is a fantastic table that shows the various stages and patient presentations for breast cancer-related lymphedema from the APTA's Academy for Oncologic Physical Therapy's Clinical Practice Guidelines, which were published in July of 2020. So being at risk means there are no signs of symptoms or impairment, while subclinical or stage 0 lymphedema is not visible, but evidence of an impairment is shown on clinical measures such as bioimpedance. In early stage lymphedema, or stage 1, it's defined by swelling that is visible but subsides with elevation. And moderate lymphedema, or stage 2, presents with consistent volume changes and pitting is typically present. But elevation is not effective in reducing the swelling, and fibrotic tissue changes begin to occur at this time. In late lymphedema, or stage 3, skin changes become prominent with anatomical changes to shape and very fibrotic and thickened tissues. This lymphedema staging model can help therapists assess the severity of a patient's lymphedema to create a treatment plan for that individual. Treatment for breast cancer-related lymphedema will be covered in a separate presentation. And that's Cancer-Related Lymphedema 101. For more cancer rehabilitation topics related to breast cancer, be sure to follow along with the Oncologic Academy's resources for more presentations. Thanks, everyone.